Welcome to Lurie Children's Facebook Live on flu and COVID-19. I'm your host, Julianne Bardaly, and today I'm joined by Dr. Ravi Jhaveri, Associate Division Head of Pediatric Infectious Diseases at Lurie Children's. This flu season causes heightened concern because we are in the middle of a pandemic. We'll talk to Dr. Jhaveri today about the importance of getting this year's flu vaccine, the symptoms of flu and COVID-19, and more. During the broadcast, please make sure to ask questions, and we'll do our best to answer them live. If you have questions specifically about your child's health, please reach out directly to their physician. So, this flu season is a little bit different. We're in the middle of a pandemic. Is it more important than ever to get your flu shot this year?
Yeah, so good afternoon, everyone. It's really important this year. There is a lot of overlap with the symptoms of flu and the symptoms of COVID, and so we really want to try to make sure that people are as protected as they can be from the flu.
And what are the symptoms of flu versus COVID? Because there's going to be some concern that you have COVID, but you might have flu, or vice versa.
Sure. So the flu is pretty abrupt in its onset. You know, people talk about how it kind of hits people over the head like a sledgehammer. And so you can have really abrupt onset of fevers, of chills, of muscle aches, and then usually the difficulty breathing doesn't happen right away. It's usually those, but that will come soon after that. Patients that we've seen with COVID symptoms, it tends to be a little more slower or gradual in onset. What makes flu different than others is really that abrupt onset.
Okay. And then if someone does experience symptoms and they go into their healthcare provider, will they automatically be tested this year for COVID and flu?
So because of the overlap, because patients may present a little bit later, most of the testing strategies that we have will test for multiple things. So we talked about COVID, we talked about flu, but RSV is another respiratory virus that can happen in kids over the winter months. And so many of the testing methods that we have will test for multiple things at the same time.
And then with flu and COVID, we've heard, children experience milder symptoms with COVID. Is that the same case with flu? Who's at most risk for complications of flu?
So we tend to think, when we think about the highest risk patients, just in terms of numbers, we tend to think about patients that have chronic medical conditions, people who are what we would call medically fragile, so people with heart and lung disease, people that have neurologic disease like epilepsy or other things. But I want to emphasize that each year at Lurie, we have a number of children that unfortunately get either really sick or perhaps even die that are otherwise perfectly healthy. And so it's no one is at zero risk. And so the flu vaccine is recommended for all children 6 months and above. And so we really stress the importance of making sure that everyone gets vaccine.
And let's talk about that. You said, it's recommended for 6 months and above. Why is it that younger children can't receive the flu vaccine, and how can we protect them?
Okay, so part of that has to do with the way that when babies are born, they get a lot of their immunity from their moms. It's passed along at birth, and so that antibody is really good in terms of that it protects them. But for certain vaccines, it can be a problem because that level of maternal antibody can blunt your response to whatever vaccine you're getting. And so some vaccines we have to wait several months to give. Mm-hmm. And so flu vaccine is one of those where it wouldn't necessarily work in those first couple of months. So the best recommendations we have for protecting infants are to make sure that everyone around the baby is vaccinated. It's what we call the cocooning strategy. So parents, grandparents, daycare workers, home attendants, whomever else is with the baby. And then obviously we also stress the idea that if people have symptoms, they really need to steer clear.
And then if you're pregnant, it's important to get your flu shot.
Absolutely.
In pregnancy, right?
It's recommended for all pregnant women. We know that with certain strains of flu, there is a much greater risk of severe disease. And when we had the 2009 H1N1 outbreak, one of the cardinal features of that outbreak was actually an increased number of deaths and severe illness in pregnant women. So What about that strain? We don't know, but for sure, pregnant women are at increased risk and definitely need their vaccine.
And children who are 6 months or older and receiving the flu vaccine for the first time, I know I went through it with both my children, they have to receive 2 doses. Can you talk about why that's so important?
Yeah, so the first season you get vaccine, it's usually a younger child who has not had the flu before and has not had the vaccine. And so what we've learned in terms of the science is that the first season, the first time your immune system sees the flu, it's a really strong imprint, okay? And so we've learned that that first season is a really important season. And so we want to try to make as strong an imprint as possible. And so that's the reason why giving that 2 doses instead of just the 1 dose is really important that first season. Okay.
And then new this year, or I feel like it hasn't been necessarily available in recent years, was the nasal vaccine.
Sure.
My own 5-year-old opted for that because she's terrified of shots, and I had my own questions about it, whether or not it's as effective,
Sure.
and she's actually getting what she needs.
Yeah.
Why is
So
it available?
Yeah, so for a good 10 or 15 years, the intranasal vaccine was available and was slowly being used, and up until the 2016 season was actually a pretty reliable option for us in terms of preventing flu. So for a couple of seasons, we realized, starting around 2013 through the 2015-2016 season, that the intranasal vaccine wasn't offering the protection it was supposed to. And it seemed like what happened is, after some further studies, that one of the specific strains, so there's multiple strains of flu that are included in every vaccine, 4 different ones usually. One of the strains was not replicating well in that vaccine. And so because it's a live and weakened vaccine, it's because it's live, it needs to replicate in your nose and in your upper airways. And so because it wasn't replicating well, it wasn't protecting well. And so what's been done over the last couple of years to fix the problem was swapping out that strain that wasn't replicating well for one that's better. And so the studies have shown that the current version, the reformulated version of the vaccine, replicates well, produces the right kind of immunity in patients well, and actually this reformulated version of the vaccine has been used in other parts of the world. So specifically, the United Kingdom actually uses it as the only childhood option. They have a universal school-based vaccine program, and they've seen good levels of protection, as good as or better than the injectable version that we would be using. So the public health groups have re-endorsed it as an equal option. So because many kids, like your own, certainly prefer getting the nasal spray version, and it's a quick and efficient way to deliver vaccine.
And usually tear-free.
Relatively tear-free, yes, that's right.
Well, let's talk a little bit about how someone gets the flu vaccine. That looks a little different this year, and I know sometimes we have concerns about the flu vaccine shortage. This year poses some complications just because of COVID-19.
Yeah.
What can people expect, and where can they get the flu vaccine?
Yeah, so typically, the old sort of model was that kids would go to their pediatrician's office, get their vaccine either during a scheduled visit or as a standalone flu vaccine visit, right? So because of the challenges moving people in and out of offices in the current era, and with the distancing that's required, that's become a logistical challenge for many offices. And so we've had to explore different kinds of options for delivering vaccine. And so one of the couple of things are the channels you can still get vaccine besides your pediatrician's office. You can go to an urgent care. So I actually had to take my kids to an urgent care last year because we were booked. Our pediatrician was booked. And so that actually worked pretty well. And most urgent cares are actually equipped to handle and vaccinate kids. So you'll have to just check to make sure that different urgent cares have vaccine available. Do you need to adjust that?
Just want to make sure we're still live.
Okay.
Technology.
Yes. So besides urgent cares, many pharmacies now are equipped to provide vaccine to kids. It varies based on whether it's a pharmacist doing it or one of the in-pharmacy sort of minute clinic type things as to who can give the vaccine and how young a child they can vaccinate. So many of them will stop at 10. Some will go lower if they've got a nurse practitioner, a PA, or someone that's stationed there. So it's also important to check if you're going to go to a pharmacy to call to make sure they have a supply and then to see how young they're able to manage kids.
Right, because that varies state by state.
It varies state by state. It even varies depending on pharmacy to pharmacy,
Okay.
again, who is manning it and who has supply. Other options, potentially, lots of workplaces are trying to expand the options not only for vaccinating their own employees, but also employee families. And so it may be that you may be able to get vaccine through one of those channels. Other public health type centers, health centers, should have vaccine and have open doors. Lurie, for instance, has a free flu vaccine program. So we've been trying to vaccinate family members who present with their kids for different appointments and trying to also offer vaccine at any point that you're seen in the Lurie system. So kids that are seen as part of their clinic, kids that are admitted to the hospital for whatever reason, if it's unrelated, and then actually kids that might present to the emergency department for other reasons. We're increasing our ability to deliver vaccine in the ED. So we're also doing our best to try to push vaccine out through as many channels as we can. And just, if I could, I just want to go back. You had mentioned the issues about supply.
Yeah.
So currently it seems like we are on track for supply. We are giving both injectable and intranasal right now, so we've got allotments of both. We got an early on-time shipment, and then I think we're scheduled to get other shipments. So far supply looks okay. So I think that's also important, but it's good for parents to just check before they go anywhere, just to make sure that each place has vaccine.
And is there an ideal time to get the flu vaccine when it, before it peaks? I think we are just starting really to maybe October is the month that we look for flu.
Yeah.
Is it better to get it ahead of it, or?
So I would say there's not necessarily any ideal time. I think what we would say is that even as the season gets underway, that you can still get vaccine. It's never too late. What I would say is that we would prefer you get vaccine and we get as many people vaccinated before flu starts to circulate in high numbers. So that's why we tend to get flu vaccine shipped to us somewhere around September. And so we're rolling it out. And so we spent a lot of October and November and early December trying to get as many people vaccinated before flu really starts to peak, which is usually January, February, March is really the peak of the season. Sometimes we'll see an earlier onset where it'll happen closer to Thanksgiving or a little after that. And that's when we're kind of in trouble because we haven't fully vaccinated everyone. So early season can be a problem.
Yeah. And when you receive the vaccine, is there a time period within your body's recognizing it and it actually will take charge and work?
Yeah, so it usually takes, we like to say it takes between a week and 2 weeks for your body to fully sort of rev up to produce vaccines. That's very similar to most other vaccines. So you're not going to have protection tomorrow. It'll take a little while. Part of it, yes. So that's important to get it earlier. And so it will, it just takes a little bit of time.
Right. And we had a question from a viewer. Does Lurie provide flu shots to outpatient families and kids?
Yeah, so we have had a program for several years where if a patient presents to any of our clinics and satellites, we have alerts that we'll fire that recommend to providers to ask about whether a patient's gotten flu vaccine. And if they haven't had it but need it, we do our best to try to give it. All that is predicated on having supplies available, but we really try to make sure that we've got the supplies. And currently, right now, we have supplies to give. So if any of the families are seen at the main Lurie site or at our affiliate sites, you should be able to get vaccine. You can ask for it.
That's great.
And they should be asking you as well.
Yeah. So we mentioned earlier this flu season's a little more complicated because we're in the middle of a pandemic. Is it possible to have flu and COVID at the same time?
So we're still learning. What we know about other viruses is that you can have co-infection or sequential infection. So you might have one and then the other. And so that's going to be obviously one of the big challenges. When we think about the respiratory virus season without COVID or pre-COVID, we tended to think about the RSV virus usually starting November, December, and then sort of starting to taper off a little bit in January, and then the flu peak coming after that. But we have had patients that have had sort of sequential ones. So obviously the concern that we have now is that with the steady sort of COVID community activity and then a surge of flu, that could really stress all of our healthcare resources, right? So doctors' offices will be waiting to see patients, urgent cares, emergency departments, and then obviously for the sickest kids, potentially hospitals and the like. So, you know, the flu vaccine, just to reiterate, is still the best option we have to try to protect you against the flu.
And then in addition, we would want to continue to mask, social distance, and good hand hygiene.
All of our COVID precautions will also help reduce the risk of the flu. So it's spread by the same droplets that you would cough or sneeze or shake hands. And so all of the things that we're doing to try to minimize spread of COVID should also help against the flu.
What would you say to a family who's considering not getting their children vaccinated against the flu this season just because they feel, you know, with remote virtual learning, they're not in that environment where they're coming in contact with peers who might spread germs? There's a decrease in maybe that spreadable, you know, communicable diseases.
Yeah.
What's your message?
So I would go back to the idea that you never really know when risk is going to come up. Okay. And so we still go out and about. You never know who's going to be sick at any one point. You may encounter even a friend or family member that you may feel comfortable with, right? If you're people, there's lots of students working in pods, and kids especially are kids. They tend to naturally want to socialize, even young adults as well. And so the flu vaccine, again, is the single best way to ensure and reduce your risk of flu.
Let's go back to the symptoms of flu versus COVID. You mentioned that flu kind of comes at you quickly and you know, really abruptly. Talk about the symptoms again.
Yeah, so the symptoms again, so the classic flu, abrupt onset of fever, chills, muscle aches, sometimes cough and sneezing, and then can progress to difficulty breathing. Now, when I say classic, that means that a lot of patients will fit that. But there are patients that have more mild symptoms. They might just have fever. They might just have sort of some chills and the like. So there is still the overlap with a lot of what we see with COVID or RSV or the like. So, so again, it's sometimes you'll be able to say, yeah, I'm pretty confident this is the flu. But I think there's still going to be a lot of overlap with others.
And then treatment for each flu and COVID and even RSV.
Right. So, so there's been a lot, obviously, in the recent news about treatment of COVID. What I would say is that when we think about our patients here in the hospital, the treatments we talk about are the antiviral remdesivir. We have used that for our sickest patients. It's not something that we're using for patients who are more mildly ill, who don't need to come into the hospital. We have also used the steroid medication that was mentioned, the dexamethasone. That can be used for more moderate and severe infections with COVID. We haven't yet used, we have some studies with some of the experimental therapies that have been mentioned in the news. So I can't speak to that because I personally haven't been involved in those. We haven't had very many yet. So, you know, they've shown promise in adults. And so we're hoping that will also translate into benefit for kids. So
if someone in your family comes down with flu and even COVID, normal course of treatment at home first with fluids, rest.
Yeah. So if we're talking about COVID, yes, it's supportive care. Okay. If we're talking about flu, there are approved treatments for flu that are still available that we've been using for some for several years. Some are a little bit newer. So if you were to have symptoms for flu and you got tested, for many of those medicines, the sooner you start the treatment, during the course of your symptoms, the better. So the ones that people have heard about usually are the Tamiflu, right? So Tamiflu is an oral medication. We've been using it for many years. It has been demonstrated for patients who are out of the hospital who have mild or moderate illness to reduce the symptoms, the severity of symptoms, and then also the duration of symptoms. Tamiflu does have some side effects. It can cause people to have some nausea and vomiting and diarrhea, so it can be uncomfortable sometimes to take. And that's been one of the challenges. There is a newer medicine that's been around for the last year and a half or so. It's called Baloxavir. Baloxavir doesn't have the same kind of symptoms, GI symptoms specifically. It is a one-time dose too. So the Tamiflu medication you take for 5 days. Okay. The Baloxavir dose you only take it once. And it works in a different target against the virus than the Tamiflu does. So the challenge with Baloxavir is that because it's new, it's more expensive. It's less readily available, and so parents and patients need to know that there may be a big upfront cost. I think it's around $100 or so. So I think they just need to know that's that. Whereas the Tamiflu is covered by virtually all insurance and also by Medicaid and other public insurance. So you can pretty much get it from anywhere. So that's the advantage of the Tamiflu.
Just to understand the rate of the flu and COVID that we're seeing in the country and in Illinois and Chicago, should a family or bring their child when they suspect flu or COVID to get tested at their doctor's office, if that's possible?
Yeah, so I think it's important for a lot of the reasons we talked about, right? You never know, what I try to remind people, because I think there's a sense of complacency about the flu because it happens every year, right? Is each year in the United States, between 100 and 200 kids, otherwise healthy kids, die of the flu, okay? And, the adult numbers are staggeringly high beyond that. But we have a death or two each year from kids. So we never know. You can't predict who's going to ultimately have a bad outcome. So we encourage testing and, if necessary, treatment as soon as possible. So go ahead.
No, I was just going to say, I think a lot of what COVID has put on families is that apprehension of seeking care at your doctor's office because they're worried about catching something there, like COVID. Can you talk a little bit about how, most offices and how they're handling the safety protocols?
Yes, absolutely. So just like Julianne and I are sitting here with our masks on, the protocols in virtually all offices now involve screening for symptoms. If anyone has symptoms, they have to stay home, so they're not in office. Universal masking, so wear a mask at all times, okay? Eye protection when you're dealing with patients. So many of us either have goggles or a face shield, okay? And so what I would say, and I'll share this experience we had at Lurie. So in the early days of COVID back in March and April, before we started universal masking, we had a real problem with transmission amongst staff, right? So sitting next to each other or in the same room, staff had mild symptoms or didn't think that it was serious. And we had sort of mini outbreaks amongst our staff. Since we have shifted to the screening that we do and the universal masking, we have not had that problem at all. Okay, we have not had those cases at all. And so I feel very comfortable myself and in advising patients that as long as you go to an office that's observing these protocols, you are not going to be at risk. We have not seen the kind of transmission in the hospital when these precautions are in place. Okay, so I want to stress that when people think about their risk of acquiring COVID, it's going to be community risk out and about if people aren't wearing masks or they're in close quarters and not taking appropriate precautions. Okay, so seeing someone in a healthcare environment with the appropriate precautions in place does not present a risk for flu or COVID.
Yeah, and I think from personal experience, my daughter's pediatric practice They had somebody outside the office who took temperatures, gave us hand sanitizers, and even a separate waiting room for children who were experiencing symptoms.
Yes, and other practices are managing it where you're not in the waiting room, right? They call you on your cell phone, you walk in from the car, and there's no area where people can mix. That's not outdoors and protected. So different offices are doing things a little bit differently, but the idea is that when they're dealing with patients, everybody's wearing a mask, everybody's got eye protection, and so the precautions are in place to protect.
And I think it's a really important message to stress too, not just to go to your healthcare provider for a flu shot this year, but for those routine visits and vaccinations that your child needs to keep on track. Right?
Absolutely. So in the beginning, when we had our shelter-in-place order, the CDC did send out reports, and we noticed in our system that we had a big backlog of patients that were due for their vaccine. So we have worked through most of those, especially the infant kids that have to come in. We're still, I think, a little behind with our teens and preteens who need their boosters. There may be some that are still a little bit, and we know in our clinics our numbers are not quite where they were still. And so with that, I think there are still some patients who are reluctant to come. And I would say you do absolutely need to get your regular care. If you have chronic illnesses, you need to get that care. And your ongoing health maintenance, you need to get that care.
Because putting something off now could potentially lead to a bigger, more serious problem without attention.
Yes, and we've definitely seen that for adults and children, that kids and adults who needed care sometimes come in too late and they're very sick. So it's really important. You should feel comfortable being able to be seen.
Now let's talk about vaccines and how they actually work. The flu vaccine we have to get every year. I know there's research going on. Scientists are hard at work at developing a COVID-19 vaccine.
Yeah.
Is there an expectation, because we are seeing maybe different strands of COVID, that will, once the vaccine is developed, we'll have to do this yearly like the flu vaccine? Talk a little bit about that.
Yeah, so there's a couple of questions in there, so I'm going to try to go through them one by one. So let's talk about the flu vaccine and why you need it every year. Okay, so the flu vaccine targets two of the major proteins of the virus. Okay, and one of the challenges with flu, as you alluded to, is that year over year, different strains of flu circulate, and so the target changes a little bit each year. Okay, and so that's why we need to continuously get a new vaccine every year, because the strains may change because our target is changing. Okay, we don't know yet what's going to happen with COVID. Okay, we know that there's some evolution that's happening with the virus, but we don't yet know if that's going to relate to needing a new or refreshed vaccine after we get the first one. Okay, so a lot of that is still up in the air. What I would say is that, for many of the other vaccines we have, we routinely give booster doses. It's not necessarily every year, but sometimes it's every couple of years. So depending on what happens with COVID, if it ends up being sort of a steady challenge for us, it may be that we get this first version of vaccine and we give it to everybody now, and then various people might need boosters a couple of years from now, maybe with the same version of vaccine, maybe with a different version. There's a lot that's still up in the air. Just as far as the COVID vaccines that are in the pipeline right now, there are several different options that I think, again, in early studies seem very promising, but we still have a lot to learn about them. Our number one priority with any vaccine is to make sure that it's safe to give, okay? And so when we think about safety and we think about the testing required, many of the vaccines that we use universally for our infants have been tested on tens of thousands of infants, okay? And so we want to feel comfortable that even a 1 in 1,000 side effect is not something we can tolerate when you're giving it to 3 million people, right? Or 30 million people or 300 million people, right? So really stressing that the vaccines need to be studied and need to be shown that they're safe. I think the companies have said that they're not going to compromise their safety protocols, regardless of what is being discussed in other channels, because they're committed to making sure that they deliver a product that they know is going to work and be safe.
So then, in the meantime, we can protect ourselves against flu by getting the flu vaccine and protect ourselves against COVID by the standard.
By social distancing, wearing a mask, screening out, don't go to work, don't hang out with your friends if you have symptoms, good hand hygiene, all that stuff, yeah.
And anything in closing as we wrap up?
I just want to again express the importance of getting the vaccine. It's not perfect, but it's the best thing we have. And so I think what I like to share with parents and families is it's sometimes it's not just about yourself. We all have friends, neighbors, loved ones, family members who may have medical conditions. They have cancer and need chemotherapy or whatever. And so part of it is our responsibility to them to try to protect them as well. And so getting a vaccine, it's not just about us, it's about the ones we love too. Okay?
I think that's a great way to end.
All right.
Thank you.
Thanks very
for
much.
joining us.
Thank you.